In keeping with all established protocols, good evening to all. And as a gentleman, I will cede 2 minutes of my time to the ladies to come. For far too long, sexual violence has been a silent issue in the public health sector, meaning that we as medical practitioners see patients as one-off, not in terms of a disregard of the gravity of the situation and the impact this incident might have on their life or the life of their family, but we see them as an isolated event, one patient at a time, failing to make that vital link and to treat the incidence of sexual violence as if it's a transmittable or non-communicable disease. We in public health borrow from the business world to help improve our strategies to combat these ills of non-communicable and infectious disease. And so it is time we lend to the social sector some of our strategies, the public health approach, to help prevent and combat sexual violence. Why do I say this? I say this because we are one of the frontline workers who see these patients at the first off. And if we are able to connect the dots and collaborate with our counterparts and key stakeholders, we can effectively come to a successful end to sexual violence. We can do this by, one, conducting research, not only on the medical harms of sexual violence, but to also ascertain what are some of the causal factors and protective factors that might protect somebody from sexual violence or predispose somebody to sexual violence. Not only looking at the survivors, but looking at the perpetrators as well. What factors prevent someone from being a perpetrator and what factors could lead to someone being a perpetrator. We must also now try to focus to demonstrate the costs of treating persons who have suffered sexual violence in the public health system. For example, Unicef had donated rape kits to Region 4 at a total of $3 million. This is a cost that if we had decreased the incidence of sexual violence, we could divert these funds to other public health ills. Next, we in the public health sector must use the health promotion tactics that we learn to lobby policymakers and patients to get them to adopt healthy eating habits, to build public awareness about sexual violence as well. During our one-on-one sessions with patients, this could be an issue that we could raise. We must also strengthen and create a sense of shared responsibility and understanding that sexual violence is a public health issue as well. And that concludes my presentation.